Good morning all. I am Professor Sapna Varghese, Principal MIT Kumaon College of Nursing. So today we are going to deal about tonsillitis. The introduction related to tonsillitis. Tonsillitis is a common inflammatory condition affecting the palatine tonsils, accounting for approximately 1.3% of outpatient visit. The condition is typically caused by viral or bacterial infections and manifest with symptoms such as sore throat, fever, odynophagia, and tonsillar erythema or exudate. So here, related to the introduction, tonsillitis. Itis, it is an inflammation of the tonsils. So it's a common inflammatory condition affecting the palatine tonsils. What do you mean by palatine tonsils? What is palatine? Palatine is palate. Okay, it's the roof of the mouth. And tonsils, where it is? Tonsils, it is pair of lymphoid or immune tissues located on the both sides of the back of our throat. So what is happening here? It is the inflammation. Itis, it is the inflammation. Itis means inflammation. So tonsillitis, it is the inflammation happening where palatine tonsils area. So here the condition is typically caused by viral or bacterial infections. So many conditions are there. The main conditions are due to the virus and bacteria. Different types of virus like rhinovirus are there, then HIV virus, common cold influenza, and next regarding the bacteria, streptococcus bacteria, staphylococcus bacteria, that will be leading in the later topics and all. So here due to the virus and bacteria manifestations are there, the symptoms such as sore throat, fever. What do you mean by sore throat? Sore throat means it is scratchy or irritating the throat. Here fever will be there, odynophagia and tonsillar erythema. What do you mean by odynophagia? Odynophagia means it is painful swallowing. So here the question arises, what is the difference between odynophagia and dysphagia? Dysphagia means it is difficulty swallowing and odynophagia is painful swallowing. When a person is getting infected due to the virus or bacteria, and what is happening, inflammation of the tonsils will be there, that will be leading to one of the symptom, it is odynophagia, painful swallowing. Next is tonsillar erythema. What is tonsillar erythema? Palatine tonsils will become red in color due to the inflammation. The tonsils part area that becomes red in color. That is related to the introduction. So tonsillitis, it is inflammation. It is occurring due to the virus or bacteria that will be leading to painful swallowing, and the same time redness will be there in the palatine tonsils, and here the person will be suffering from sore throat, that is itching, then scratchy throat will be there, fever also will be present in the person. Next, we will move the main part, definition of tonsillitis. Tonsillitis is the inflammation of the tonsils as a result of infection by a virus or bacteria. Due to the etiological factors I have said regarding the virus and the bacteria. Virus, so many types of virus are there. I have said regarding influenza virus will be there, rhinovirus, etc. Same here, the bacteria, staphylococcus, streptococcus bacteria, this all the bacteria and the virus that will be leading to tonsillitis, and itis is inflammation, medical part, and here tonsillitis means inflammation of the tonsils. I have said it is affecting the palatine tonsils, and you know what is palate and you know what is tonsils. It is located in the back of our throat. So inflammation due to the bacteria and virus. That is related to the definition of tonsillitis. Next, we will move the types of tonsillitis. So, three types of tonsillitis are there. First one is acute tonsillitis, second one is chronic tonsillitis, and the third one is recurrent tonsillitis. From the word acute, chronic, and recurrent. Acute means it is short period. That means maybe due to some days or weeks, the patient will be suffering from tonsillitis, inflammation of the tonsil area. Next, chronic means it is for long. That means sometimes it goes to month, then years. Lifelong also some patients or person will be experiencing tonsillitis. Then recurrent. What is the meaning of recurrent? It is repeated. So first we will start the number one types of tonsillitis, that is acute tonsillitis. It is an inflammation of the pharyngeal tonsils that frequently arises in combination with an inflammation of the pharynx, tonsillopharyngitis. That means in the case of acute tonsillitis, it is affecting both the part of tonsil area as well as the pharyngeal area. The inflammation will occur both the pharyngeal area as well as the tonsils. Next point, it is characterized by a sudden onset of fever, sore throat and painful swallowing. Painful swallowing, I have said regarding the medical term odynophagia and the difference between odynophagia and dysphagia. Odynophagia is painful swallowing and dysphagia is difficulty swallowing. So it is characterized by sudden onset of fever. The person will start with the onset of fever, then will go to sore throat. What is sore throat? Scratchy. A person will feel itchy or scratchy or irritation will be there in the throat, and painful swallowing I have dealt. Next, the symptoms in the case of acute tonsillitis usually last around 3 to 4 days, but can last up to 2 weeks. That's I have said regarding the difference between acute tonsillitis and chronic tonsillitis. So acute, that will be only for weeks, but in the chronic stage, definitely the acute tonsillitis a person is suffering and it is not treated in the proper way, then that will go to chronic tonsillitis, that is for years, months, and sometimes it is for lifelong for a person or a patient. Now we will move. Next is the recurrent tonsillitis. Before that, chronic tonsillitis. Tonsillitis can be caused by infections such as viruses, that is CMV. What is CMV? Cytomegalovirus, herpes simplex virus, Epstein-Barr virus, or bacteria such as strep throat. Group A streptococcus is a main bacteria. Staphylococcus aureus, the same time streptococcus bacteria. Then in the case of virus, herpes simplex virus, we have said regarding HIV virus, hepatitis A, rhinovirus, influenza virus. These infections for the tonsillitis caused by the main bacteria and virus. Next is the common signs and symptoms include sore throat, bad breath, fever. I have said regarding the sore throat, that is what is happening here. The throat gets scratchy or irritated. Chronic tonsillitis cases have symptoms which persist beyond 2 weeks. What is the meaning of persist? It is continue beyond 2 weeks. What is beyond? Here after 2 weeks also chances are there a person will be continuing the tonsillitis. That is means inflammation, the bad breath, sore throat will be there, painful swallowing, everything, the symptoms will be continue. So in the case of chronic tonsillitis, once the patient is diagnosed as acute tonsillitis, the patient has to follow the medication as per the physician order, as per the nurse instructions. So when a patient is following, then definitely it will be not persist and it will not continue the infection. It will be subside and the patient will be treated. But in the case of the patient is not taking care of themselves and not listening the doctors and nurses advice, and that time that definitely the patient will be suffering or will goes to the chronic tonsillitis, and it will take, as I have said, for not only weeks, it will go for months and years. The patient will be suffering from so many symptoms like it will be persist beyond the 2 weeks. Next, we will move. The next part of tonsillitis type is recurrent tonsillitis. From the name only, what do you mean by recurrent? It is repeated. A person or a patient is getting repeated tonsillitis. It occurs when a person suffers from multiple episodes of tonsillitis in a year. What do you mean by multiple episodes here? Chances are there a patient or a person is getting 7 or more than 7 types of episodes in a year. In a year, chances are there, that is multiple episodes, not only 2-3 times, chances are there more than 7 times or equal to greater than the person will be suffering from recurrent. That is again multiple episode, that is repeated tonsillitis will be occur for the person. So here we dealt about the types. First one is acute tonsillitis, second one is chronic tonsillitis, and third one is recurrent. Acute, I have said that it is for weeks, and in the case of chronic, it is not treated acute, that will move to chronic stage. And this chronic tonsillitis, it is dealing with the how many, maybe months or years or lifelong for a person. Next, recurrent tonsillitis, I have said a person suffers from multiple episodes of tonsillitis in a year if we are not treated in the proper way by the guidance of our doctors and nurses. Next, we will move to the Etiology of the tonsillitis. What are the etiological factors? Infection with a common virus such as common cold, example rhinovirus, HIV I have said, regarding the hepatitis A. Next, bacterial infection. So many types of bacteria are there, but especially which type of bacteria? That is our group A, streptococcus is very dangerous, and the same time some bacteria are the gram-positive bacteria, streptococcus pyogenes also this causes strep throat. That means what is happening here? Streptococcus pyogenes, it is gram-positive bacteria. When it is entered, that will leads to infection and inflammation, leads to the inflammation of the tonsils. So bacteria, I have said regarding bacteria, Streptococcus bacteria, Staphylococcus bacteria, these all are the main bacteria that will be affecting the person who is suffering from tonsillitis. So etiological factors is mainly due to the virus and the bacteria. Next, we will move to the risk factors. So here, so many risk factors are there. So in the case of risk factors, first one is young age, next frequent exposure to germs, strep infection, rheumatic fever, post-streptococcal glomerulonephritis. So first one is young age. What is happening in the case of risk factors in the case of young age? Tonsillitis, it most often occurs in children, especially the age group of 5 to 15. Okay, so here the tonsillitis caused by bacteria, it's the most common in children ages 5 to 15, while viral tonsillitis are there, it is more common for the young children, younger children is there. So in the case of young age, most common occurs in the children. And next is frequent exposure to germs, school age children. You know that when the peers are there, school age means the school children will be with the exposed to the virus and bacteria, so that can cause to tonsillitis. So peer group will be there. The peer group will be there means friends will be there. They are sharing the things what they are touched. The infection chances are there to spread. The close contact will be there in the school children. So that is known as frequent exposure to germs and all. Next part of risk factor is strep infection due to group A streptococcus. It's a dangerous bacteria that is the main leading cause of the tonsillitis. Streptococcus, group A streptococcus or another strain of streptococcal bacteria. It's not treated. If any antibiotic, if the treatment is incomplete, chances are there to get the tonsillitis, and the child will be having the increased risk of glomerulonephritis, streptococcal glomerulonephritis, as well as rheumatic fever. So here, in the case of rheumatic fever, an inflammatory disorder that affects the heart, joints, and other tissues. When a children or a person is not treated correctly with that is the antibiotic is incomplete, then what will happen? Definitely that will lead to rheumatic fever and post-streptococcal glomerulonephritis. What do you mean by rheumatic fever? Inflammatory disorder that affects our heart, joints, and other tissue. That is known as rheumatic fever. And here post-streptococcal glomerulonephritis. What do you mean by glomerulonephritis? It is the inflammation of the glomeruli. Okay, so here an inflammatory disorder of the kidneys that results in adequate removal of wastage and excess fluids from the blood. So it is affecting even the kidney. If it are not treated or the antibiotic is incomplete, it will be leading to rheumatic fever, post-streptococcal glomerulonephritis. Next, we will move the part is clinical manifestation, that is the signs and symptoms. So here the clinical manifestation, that is red. What is happening here in the symptoms? Red swollen tonsils will be there, white or yellow coating or patches on the tonsils, sore throat, difficult or painful swallowing. Difficulty swallowing, what is the thing? Difficulty swallowing, what is the medical term? It is dysphagia. And in the case of painful swallowing, what is odinophagia. Fever, a scratchy, muffled or throaty voice. What do you mean by muffled, muted? Scratchy, you know, itching will be there, itching, irritating. Muffled means what it is? It is muted. And in the case of throaty voice, what is muffled or throaty voice? Heavy, thick voice will be there. A person is suffering from tonsillitis. Muted, heavy, thick voice will be there. Next is enlarged tender glands, lymph nodes in the neck. So due to the tonsillitis, what is happening due to the virus and bacteria, tonsillitis will be there, infection and inflammation. So the person or a patient will be having what will be there? Enlarged tender glands. The lymph nodes in the neck will be enlarged due to the swelling. Next clinical manifestation is bad breath, stomach ache, pain in the stomach, stiff neck, spasticity will be there. Very difficulty to move the neck, headache, drooling due to difficult or painful swallowing. Drooling saliva, you know that. Okay, so here drooling due to difficulty, the saliva not able to swallow because of the painful or irritation or scratchy throat. The refusal to eat, chances are there the patient will not because of the painful swallowing, odinophagia. Already dysphagia, then odinophagia, painful swallowing and difficulty swallowing, that will be leading to drooling of the saliva. The same time refusal to eat. They were not able to have any of the fluids or the foods. Unusual fussiness, or what do you mean by fussiness? Upset will be there. So the main clinical manifestation, signs and symptoms, once the patient is started, that means fever will be there, headache will be there, stomach ache, stiff neck. These all are the signs and symptoms that the patient will go to the hospital and will say to the doctors and nurses that I am suffering from fever from last these many days and all. So that time the doctor will start for the investigations and all, then we'll come to know that the patient is suffering from tonsillitis. Now we can move to the pathophysiology. In the case of pathophysiology, due to the etiological factors, what are the etiological factors here? Virus, bacteria. So these rhinovirus, influenza virus, group A, streptococcus, staphylococcus aureus, when this etiological factors, this microorganism enter invasion of mucous membrane, it enter the mucous membrane, and what is happening here? Inflammation, inflammatory infection of the tonsils. Infection due to the virus and bacteria, then inflammation will start. Where? Tonsil area, back of our throat. Enlarged lymph nodes on both sides of the neck. What will happen? The lymph nodes will become enlarged due to the inflammation. Swelling will be there. So enlarged lymph nodes. So these enlarged lymph nodes will lead to difficulty in breathing. When the patient is having enlarged lymph node, the patient definitely will suffer from the difficulty in breathing. This infection lasts about 5 days. If it is, I have said, acute, it will be 3 to 5 days or 2 weeks. But in the case of chronic, when the patient is not completely following the instruction of the doctors and nurses, not completely taking the medical antibiotics treatments and all, definitely that will leads to chronic, will go to lifelong or recurrent. It is again repeating for the patient suffering from tonsillitis, maybe more than 7 times in a year. Sometimes it will go to 2 years or 3 years. So here the advice from my side, being a principal, nursing field, that you have to take care of yourself. You treat as per the doctor and nurse, continue the medications and don't skip even any of the patient. It's our responsibility being a nurse that we have to provide a nursing student in our college, that we are providing health education to the patient, those who are suffering from tonsillitis. Next part is the diagnostic evaluation. So what is diagnostic evaluation? You know that once a person is suffering from any of the clinical manifestation like fever, it is for 3 to 4 days, and sore throat will be there, scratchy, itching, irritation is there, the painful swallowing, then the patient will approach the hospital. So doctors and nurses are there. Then first what we are going to do, that is the history collection, then physical examination. The doctor will be asking your name, your age, what all the things according to the criteria of our collecting the history, the nurses and the doctors will be collecting. After that, the doctor and nurses will go for the physical examination. So the history collection, the chief complaints, present medical history, past medical history, the patient will be saying about what all the problems that I am suffering from these many days. Doctor or nurse, please help me that I am having painful swallowing. So it's our responsibility. Listen, the patient should be very calm and quiet. We should not be panicked when the patient is crying. You have to listen their problems, their complaints. Then after that, you can go for the physical examination. The doctor will say that, okay, I'll go for the physical examination. So head to toe examination is there, but here the main part is throat area. So what? Using a lighted instrument. What are the lighted instrument? Laryngoscope is there. we can visualize the tonsil part, and with the tongue depressor, we can, with the help of light, with the help of tongue depressor, we can see the tonsil area. And in some cases, ear, due to the ear infection also, END, that is ear, nose, throat, the END specialist will be there. Sometimes in the case of nasal infection, sometimes in the case of ear infection also, chances are there for the throat. So here in the case of laryngoscope, with the help of the laryngoscope, we can visualize the laryngeal area. With the help of tongue depressor, with the help of the lighted instrument, we can visualize the palatal tonsil area. And with the help of otoscope, what is otoscope? It is for the visualization of the ear, that any of the infection is there. So listening to the breathing of with a stethoscope by the doctor, and checking the enlargement of the spleen, generally palpating the neck area. These all are the physical examination by a doctor, that he can understand, or he will be diagnosed that the patient is suffering from the tonsillitis. Next, after the physical examination, the nurse and the doctor will go for the throat swab. The doctor rubs a sterile swab over the back of the throat to get a sample of secretion. The sample will be checked in the clinic or in a lab for streptococcal bacteria. See, it's a main fact or the truth what I am saying. When a person is suffering from irritation, simply some person are there, they will go for the antibiotic. No, it's a wrong method. You have to diagnose, with the help of the doctor and nurses, with the help of the lab technician, the investigation purpose, which type of bacteria, and according to that type of bacteria, only antibiotic we have to take. Simply don't take when a person is getting irritation, azithromycin or amoxicillin. No, sometimes clarithromycin also there. It is depend upon the person who is suffering from which type of bacteria. So when after the physical examination, the doctor will go for the throat swab. That is, doctor rub a sterile swab. Okay, where it is over the back of the throat, rubbing a sterile swab. Then after that, this sterile swab will be, sample of secretions are there, okay, that will be sending to the laboratory, will identify which type of virus or bacteria, whether it is group A streptococcus, staphylococcus aureus, whether any virus are there. So the confirmation will be with the help of the lab technician, that which type of bacteria or virus or the bacteria present in the secretion, with the help of throat swab. Next is complete blood count. It's very essential that when a person is suffering from infection, the complete blood count is very essential, that we will come to know regarding the total leukocyte count, the eosinophils, the ESR, the WBC white blood cells. Infection is there, definitely the WBC count will be raised for the patient. So after the diagnostic evaluation, the doctor and nurses confirm that the patient is suffering from tonsillitis. Then tonsillitis confirmation, next the doctor will go for the medical management, that is the medical treatment. Which all are the medical treatment? Antibiotic, example penicillin. If allergic, then prescribe an alternative antibiotic. Some patient, they are suffering from allergic reaction due to the penicillin antibiotic, so change that. It's a responsibility of the patient or the family members to report to the doctor and nurse that I am suffering from penicillin allergic. So the doctor don't know. You have to say, the doctor will ask, the nurse will ask, are you allergic from penicillin? Then you have to say, I'm allergic from penicillin. Then the doctor will change alternative antibiotics for that patient. Acetaminophen to relieve the pain and the fever. Gargling 3 times a day with warm salt water. Gargling 3 times a day with warm water. The same time, betadine gargle also will be advised by the doctor. It's a good treatment, the betadine gargle also. It's a good advice by the doctor. Drainage of pus from the ears. Some patients are there, they are having infection in the ears. Then with the help of the otoscope, that visualization of the ear will come to know regarding the drainage of the pus will be there. So definitely the doctor will go for the drainage of the pus from the ears. So I am saying again clearly, when you are having any problem, please approach the hospital, doctors and nurses, and don't take any of the medicine with your knowledge, that without the identification or diagnostic evaluation done by the hospital medical professionals, because it will be affecting our body. Continuously unnecessarily taking the medication or overdose also will be leading to breathing difficulty, as well as affecting our the vital organs, and definitely it will be leading to hectic situation or dangerous situation for a patient. Clear. Next, the part is surgical part. Surgical management is tonsillectomy. Ectomy, it's a removal actually here. It's a surgical procedure in which both palate and tonsils are fully removed from the back of the throat. So here the palate and tonsils, I have said what is palate and tonsils. Palate, it is actually roof of the mouth, and the tonsils, it is the back of our throat, it is located. So it's fully removed from the back of the throat. Once the patient diagnosed as tonsillitis and it is not treated in acute way and it will go to the chronic cases and it is again repeating, then doctor will say for the surgical management, that is tonsillectomy. When the medicine is not treated in a proper way for a person, then only the doctor will say for the surgical management tonsillectomy. And again I am saying, in the case of tonsils, it's a shelter of the bacteria that producing again chronic infection of a person and all. So once the tonsils removed, it will be partially regrowth will be there. That is known as the tonsillectomy. The surgical management, if the medicine is not treated in a good way for the patient, then definitely the doctor will go for the option is tonsillectomy. Next part is the main part, being a nursing student, nursing principal, nursing faculty, as well as staff nurse in the hospital, nursing management. Assess vital signs, assess mouth and throat for any infection, assess for signs of dehydration, that assess for adequate airway. Next is assess for pain using appropriate pain scale and non-pharmacological pain relief method. How we will assess the pain? We are assessing the pain with the help of some pain scale, that is numerical pain intensity scale is there. The ratings are there. We will discuss with the patient and we will come to know the patient is suffering from average pain or minor or major pain. It is according to the patient. The scale will be there, that then we will go for the non-pharmacological pain relief method. Everything the nurses with the help of the doctors only, they will undergo all the procedure as well as the medication also by the order of the physician. Non-pharmacological pain relief means relaxation technique will be the massage, etc. Okay, relaxation technique, massage are the non-pharmacological pain relief methods. So this we are undergoing here. It's very essential that it's a responsibility of the nurse to be with the patient, provide psychological support, and the non-pharmacological pain relief methods is very essential because the patient is suffering from difficulty, pain swallowing. The next is difficulty in the swallowing, as well as irritation and scratchy throat. They'll be very depressed and stressed that why it's happening to me, why the medicine is not treating in a proper way. So they'll be very tensed and stressed and anxious. Being a nurse, it's our responsibility to provide psychological support. Any complications, any side effects, any emergency part, it's a responsibility of the nurse to report to the doctor. Administer medication as per order. Whose order? By the doctor's order. The nurse not able to provide, so with the help of the doctors, we have to administer medication. Prepare patient for and assist with surgery as required. If the patient is not treated with the help of the medicine, as I have said earlier, then the doctor will go for the surgical management, that is tonsillectomy. So it's the responsibility of the nurses to prepare our patient according to the for the surgery purpose. Encourage patient to eat and drink, avoid dairy products and all. It is clear that we have to avoid the dairy products and all. Everything will be irritating the patient. And next thing is related to the provide patient for home care and prevention. It is very essential that we have to take care of the patient as well as advise the patient regarding the what is tonsillitis, advise the family members that after the surgical part removal of the tonsils, to take care how many days regarding the infection from, chances are there to getting infection from family members as well as from the outside area also. So it's very home care is a very essential part in the case of tonsillitis. Next, we will move to the complications. So here the complications. Once the patient is not taking care of himself, they are not listening the instruction of doctors and nurses, definitely the complication will move to the complications part. What will be there in the complications? Even the patient is not listening or not following the medications as per the doctor and the nurses. Otitis media, that is inflammation of the middle ear. Glomerulonephritis, I have said it is affecting the kidney area, that is glomeruli. Quinsy, it's a peritonsillar abscess, tonsil area, an abscess that develops between one of the tonsils and the wall of the throat. Clear? Next is obstructive sleep apnea. Definitely, when a patient is having difficulty in swallowing, difficulty breathing and all, and irritated, what is happening? The walls of the throat relax and block during the sleep, which causes breathing difficulty. Due to the difficulty in the swallowing, the pain, the irritation, the inflammation and the infection, the walls of the throat relax and block. During the sleep, it will be relax and block. That will be leading to the blockages due to the airway, that is related to difficulty in breathing, and that leads to poor sleep of the patient. Again, scarlet fever is there. I have said scarlatina, a condition that causes a distinctive pink red skin rash. Bacterial illness develops in some people who have strep throat. So here, where it is happening, the skin becomes the pink in color, and that will be leading to the strep throat. Due to the strep throat, what is happening? The scarlet fever will be there. That is, it is affecting condition that causes a distinctive. What do you mean by distinctive? It is a particular uncommon cases. Pink red skin rashes, bacterial illness develop in some people who have strep throat. Clear? Next is rheumatic fever. I have said it causes widespread of inflammation throughout the body, leading to symptoms such as joint pain, rashes and jerky body movements. That is what you mean by jerky body movements. It is the fast movements that a person cannot control. That is jerky movements. So here it is affecting the heart and the joints of the heart. So it's very critical, hectic situation, and it is dangerous situation. Tonsillitis, if it is not treated in the proper way, will go for chronic and recurrent situations. So it's our responsibility to take care of the patient. Being a medical field nursing student or staff nurse or a principal in the College of Nursing, even a faculty, that we have to provide the health education to the patient and the family members, that you have to take care of yourself regarding the tonsillitis cases. Go for the hospital, take the advice and opinion, the treatment from the doctors and nurses. Go for the investigation and take that treatment in a proper way, or else the patient will be suffering from recurrent tonsillitis. So my conclusion, today's topic, I'm going to wind up. Tonsillitis, it's a common infection of the palatine tonsils, and it's caused due to the bacteria and virus, and the main bacteria is streptococcus pyogens are there. It presents what all the clinical manifestation, difficulty in swallowing will be there, sore throat, fever. These all are the main symptoms, and all early diagnosis and appropriate management are essential to prevent the complications. Here, with proper treatment and hygienic practices, most cases will recover completely. If it is not recovered, then the doctor will go for the surgical. Some they are having recurrent episodes that require further evaluation. Recurrent episodes require further evaluation, and possible that is will go for the surgical intervention by the doctor and nurses, and that surgical management is known as tonsillectomy. It will be the removal of the complete tonsils from the throat. So this today is about my topic, tonsillitis. Everyone take care of yourself again and again. I'm saying, and the thing is, if a person is suffering from fever or any irritation of the throat or the pain, that please go to the hospital, take the advice and opinion, suggestion and treatment from the doctors and nurses. According to the doctor and nurses, go for the treatment. If it is not treated in the proper way, then the doctor will advise for the recurrent episodes of the, that means continuous episodes of the tonsillitis is there, means definitely the doctor will say that the patient has to go for the surgical treatment. So if you're having a fever, don't take an antibiotics unnecessarily or any of the medication. Take the opinion from the doctor. After the lab investigation, we'll come to know which type of bacteria is present in our throat. According to that, the ENT specialists are there. They will take care of you along with the nurses. So take care of yourself by not taking any of the medicine without the prescription of the doctors and without the instruction of the nurses. So thank you once again. Today, that's my wind up of the today's topic, tonsillitis. Thank you.